I'm Jessica.
And I'm Chelsea.
And we're doing a presentation on bipolar disorder.
So what is bipolar?
People with bipolar disorder experience usually intense emotional states that occur in distinct periods called mood episodes. Each mood episode represents a drastic change from a person's usual mood and behavior. An overly joyful or overexcited state is called a manic episode, and an extremely sad or hopeless state is called a depressive episode.
There are two causes of bipolar disorder. When talking about genes, bipolar disorder tends to run in families. There's also an abnormal brain structure and function. Brain imaging tools such as an MRI and a PET scan allows researchers to take pictures of the living brain at work. These tools help scientists study the brain structure and activity. Some imaging studies show how the brains of people with bipolar disorder may differ from the brains of healthy people or people with other mental disorders. Bipolar. Playing sports may trigger bipolar symptoms in a variety of ways. It takes a lot of dedication and motivation to excel as an athlete, and someone who's dealing with feelings of depression or physical fatigue as a result of bipolar disorder may find it hard to muster them. The stresses of living up to expectations, trying to gain more playing time, or even earning a starting spot on the roster are also possible triggers for bipolar behavior. When an athlete living with bipolar disorder is not receiving the treatment he or she needs, the pressure or demands of a sport may seem overwhelming, potentially affecting other aspects of life as a result. A couple athletes who have suffered from bipolar disorder include Brandon Marshall, who is a wide receiver in the NFL, and Delonte West, who is an American professional basketball player in the NBA. Unfortunately, there is no treatment for bipolar disorder. Bipolar disorder cannot be cured, but it can be treated effectively over the long term. Proper treatment helps many people with bipolar disorder, but because it is a lifelong illness, long-term, continuous treatment is needed to control symptoms. There are different types of medications that can help control symptoms of bipolar disorder. The types of medications generally used to treat bipolar disorder include mood stabilizers, atypical antipsychotics, and antidepressants. Mood stabilizers are usually the first choice to treat bipolar disorder. In general, people with bipolar disorder continue treatment with mood stabilizers for years. For example, lithium is an effective mood stabilizer. When done in combination with medication, psychotherapy can also be an effective treatment for bipolar. It can provide support, education, and guidance to people with bipolar disorder and their families, including cognitive behavioral therapy, family-focused therapy, and psychoeducation. Exercise also helps. When it comes to symptoms of bipolar disorder, exercise may improve your mood. Exercise is able to help enhance your emotions through the chemicals that working up a sweat releases through your body. When you're exerting energy, your brain sends out neurotransmitters and endorphins that are feeling good chemicals, helping you relax as well as stay motivated to take on other tasks. In addition, exercise is known to reduce immune system chemicals that may trigger depressive episodes and increase your body temperature as well, which could also produce tension-easing effects. Unfortunately, there's also no way to prevent bipolar disorder. However, getting treatment at the earliest sign of a mental health disorder can help prevent bipolar disorder or other mental health conditions from worsening. You should pay attention to warning signs, avoid drugs and alcohol, and then take medication as directed.
There are two types of bipolar disorder, bipolar 1 and bipolar 2. So, let's start off with bipolar 1. It is also known as manic depressive disorder. It is diagnosed to a person having one or more manic episodes in their lifetime, as well as having episodes of depression. Typically, symptoms of these episodes occur daily, or at least once a week. But in between these two episodes of manic and depression, a person can live a normal life. It is the most severe out of bipolar 1 and bipolar 2. Episodes of depression and mania are often referred to by having high highs and high lows. In comparison, bipolar 2 disorder is diagnosed after one or more depressive episodes and at least one episode of hypomania. The highs in bipolar 2 are called hypomanias, which aren't as high or severe as the manias in bipolar 1. Bipolar 2 disorder is sometimes misdiagnosed as major depression if the hypomanic episodes go unrecognized or unreported, because they are so small in comparison to bipolar 1 manic episodes. The episodes of depression and mania are often referred to by having low highs and high lows. The biggest difference between bipolar 1 and bipolar 2 is the severity of manic stages during their manic depressive cycles.
Thank you for listening to our presentation on bipolar disorder.